As I said before, brain science is relatively a young science, and there's still a lot that we're learning about brain health and mental health. And one of the areas, even scientifically, that has come up in the past few years and really developed is the importance of diet and supplementation in the health of the brain and the mind. And whether that's in the food that we eat or also the supplementation that we are giving our bodies in addition to the food that we eat. When we're also looking at food science and we're looking at a lot of the food that we're putting into our bodies, a lot of the food that we're putting into our body today is highly processed and really depleted of the nutrients that we really need. And so the question becomes, when we're talking about a healthy brain and healthy neurotransmitters and neurons and all of these processes to occur, really our brains and our bodies are not getting the optimal level of supplements or the optimal level just because we're not eating well enough. And even if we try, if we really look at the food that's out there, it is depleted in a lot of the nutrients, and so we're not getting our needs met. And is that one reason why we are seeing higher rates of depression or anxiety? Can it be a contributing factor? I have noticed in my practice that utilizing supplementation in a responsible way, where you're not over supplementing and you're also not taking away the importance of also food and healthy food and diet and changes in lifestyle, but when you really add supplements in a responsible way to someone's regimen, you get amazing and fantastic results. So people's depression improves, their stress levels change, their anxiety gets better, they're sleeping better, and it's the changes are actually quite tremendous. I felt so strongly about it that I developed a nutraceutical supplement line called NeuroNourish, and one of my first supplements is called Elevate. And it's really based on a lot of science that we know about the brain, and I manufactured it here. And so when I am able to utilize, for example, something like Elevate and from the NeuroNourish supplement line and use it in addition to medication and yoga and meditation and mindfulness and all these other things, the results have been really amazing. So people who don't have the supplements versus having supplementation, really scientifically based, especially for mental health. Recently, if we look at the data for the past couple of years, you'll see the difference. It's quite tremendous, and we have a lot of backing for it. So I think it's one of the areas in mental health and especially psychiatry that is continuing to grow. And I think it's a really important area that we don't look at enough. And a lot of patients come to me just to simplify their vitamin regimen, to get recommendations of a lot of the natural things they're taking out there. They go to Google and they will research, well, what's the best thing to take for depression and anxiety, and instead of running to the first vitamin store and buying 10 bottles and not knowing if they're going to work or not, they actually come to my office and get a consultation, and they'll tell me, this is what I'm taking. And I help them to simplify their regimen and really able to educate them about what's best for their depression and anxiety. And the fact that they have someone who's a medical doctor, but someone who's versed in integrative and holistic medicine and supplementation and herbs and these types of things really can, help build a lot of trust in them knowing what's really good for their bodies and for them to be taking something that ends up helping them a lot.